Hello, my name is Monica Medina-Dobbs. I'm a LDN and a CNS, and I'm going to present on my case for research grant rounds. I'm presenting case 5, preventing metabolic syndrome. We have a 40-year-old Asian male with hypertension detected during a routine evaluation. Chief complaint: client wants to watch his weight gain. Patient's body weight has been increasing 2 to 3 pounds a year for the past 3 years. History: it was confirmed reading of blood pressure several times. Patient is a current smoker. He smokes 1 pack of cigarettes a day. Currently, he's taking Laxis for edema, 20 milligrams a day, and Lipitor to lower his cholesterol, 20 milligrams a day. Symptoms: patient denies current symptoms at this time of chest pain, shortness of breath, or edema, or any visual symptoms. We also have the case, his labs and his panels. He showed total cholesterol of 120, LDL of 147, HDL of 38, and triglycerides of 150. His fasting glucose levels were 120. The question that I have for the project is: could Mediterranean diet prevent the progression of CVD? My rationale is research shows that a Mediterranean diet improves blood lipid profile, decreases oxidation stress, and lowers inflammation. My second question will be: does extra virgin olive oil and the Mediterranean diet has a better outcome for people at high risk with CVD? The rationale of olive oil is he's a monosaturated fat, mostly of oleic acid, and shows to reduce HDL and be a cardiovascular protector. And I did have a third question: does extra nuts in the Mediterranean diet shows better outcome than the Mediterranean diet alone? My rationale is nuts are low in saturated fatty acids and high in monosaturated and polysaturated fatty acids. They also contain several non-fat constituents such as plant protein, fiber, micronutrients, copper, and magnesium. They are plant steroids and fellow chemicals beneficial. They have beneficial effects on cholesterol and low density lipoprotein cholesterol levels. I also want to include an extra research because I do like to compare and correlate research when I'm looking for treatment plans that I can apply to my current patients. So I did found this new article about monosaturated fatty acids and the risk of cardiovascular disease. This one shows that it took an electronic database of Medline between 1966 and November 2012, was a search for systematic review and a meta-analysis using following search terms. It was a monosaturated fatty acids. The study concluded that values for systolic and diastolic blood pressure were found to be reduced both during short and long-term protocols using high amounts of MUFA as compared to low MUFA diets. I also added a third research, just searching the nuts and the effect on lipid profile. This research also shows that nuts are low in saturated fatty acid and high in monosaturated and polysaturated fatty acids. And it also contains several non-fat. There are plant protein, fiber, micronutrients that have copper and magnesium, and there are plant-based steroids. So this is also a great example of a good research that we can use. The research terms PICO, patient intervention comparison and outcome. My search terms were cardiovascular disease, Mediterranean diet, monosaturated fatty acids, HDL diet, fatty acids, and cardiovascular disease. This is the paper that I'm going to talk about today is the Mediterranean diet and cardiovascular health. So the introduction of the case, we have cardiovascular disease. They're taking a high-risk participants that have with diabetes or without diabetes, hyperlipidemia, and hypertension. Also, when I look at the research, has much more. They looked at people with much more susceptible to develop cardiovascular disease if they're hyperlipidemia. They have hyperlipidemia, high LDLs, low HDLs, and high triglycerides with diabetes. They smoke and they have obesity. The diets they use in this research, they use three med diets that reduce inflammation, reduce LDL, reduce oxidative stress, and reduce edema. The study overview is an RCT study with 3 arms. They have the first arm as the Mediterranean diet, supplement with extra virgin olive oil. They have the second arm is a Mediterranean diet supplemented with extra nuts, and they use the control regular diet that is a regular Mediterranean diet. The population, we're looking at 7,447 candidates were randomized and assigned into 3 med diets intervention groups. High-risk individuals for cardiovascular disease from 2003 to 2011. Populations were selected from primary care facilities affiliated with 11 recurrent sites, and they all were, as an inclusion of the protocol, they all were at high risk for cardiovascular disease but had no clinical disease at enrollment. The inclusion of the subjects were at high risk for cardiovascular disease, current smokers, overweight, hypertensive, dyslipidemia, and or family history of cardiovascular disease. They have 3 interventions, as I mentioned. The Mediterranean, which the first diet was the Mediterranean diet supplemented with extra virgin olive oil. Second diet was the Mediterranean diet supplemented with nuts, and the third control diet was advised on a low-fat diet. It also shows that they use a 14-point quantitative score of adherence of the Mediterranean diet. The data shows that the first 772 participants after intervention for 3 months show improved blood pressure, insulin sensitivity, lipid profile, and circulating inflammatory molecules with the second Mediterranean diet, which is the extra virgin olive oil intervention, versus the control diet. We can also observe in the table also it has almost the same correlation with the Mediterranean diet and the extra nuts. Data results you can see in figure 1. Men 55 over 80, women 60 to 80 years old at high risk without cardiovascular disease, with type 2 diabetes or plus 3 factors, which were smoking, hypersensitive, high LDL, low HDL, overweight, obesity, or family history of early onset of cardiovascular disease. And those are the arms. You can see them there. The extra virgin olive oil with the Med diet, with the Mediterranean diet. And you have also the Mediterranean diet plus nuts, extra nuts as a supplement. And you have your control diet that is a regular Mediterranean diet. So the participants in the second, which is the nuts arm, improve the 14-point score of adherence for the Mediterranean diet with a statistically significant difference versus the control group for 12 of the 14 points. Lifestyle and saturated fats intake were inversely correlated with the development of cardiovascular disease. The Mediterranean diet intervention can reduce the incidence of CVD in persons with high risk. Conclusion. The results clearly show to me that high unsaturated fat dietary patterns is better for cardiovascular health than a lower fat diet. The success of the study might be attributed to the extra virgin olive oil and nuts. Unsaturated fat-rich and antioxidant-rich foods that despite the fat content did not promote gain weight. For me, it means that even if we did supplement, people got extra fat in their diet, but it came from the right fats, from extra olive oil and nuts. It was extra. They got foods rich on antioxidants, and it did not promote any weight gain, any difference between the low carbs diet. Finally, nutritional genomic studies show that an adherence to the Med diet, to the Mediterranean diet, blunts the development of cardiometabolic phenotypes in genetically susceptible individuals. Importantly, the 30% cardiovascular disease risk reductions show with the Mediterranean diet in the study is of similar magnitude to that reported in statins, which is very important to me, although it is obtained at no cost for the health system. So this is a great conclusion. This paper suggests that Mediterranean diet protects against the development of cardiovascular disease. Benchmark considerations. It is RCT, randomized controlled trial, so it's one of the best where we can actually compare and observe the results, and we can have different groups and see the results and less bias. The participants of the study are like this patient, the one that we introduced on case 5. Smoking, which is one of the highlights of the patient that I have in case 5. He is a current smoker. Smoking is mentioned as a part of the high-risk inclusions for the study design. I give this study a B+. The study is relevant to my patient. A study suggests that Mediterranean diet with extra monosaturated fats is a better treatment to prevent cardiovascular disease on high-risk individuals. I have 3 references. The one that I use for the study is the one with the Mediterranean diet and cardiovascular health. That's for case 5. And the other 2 were supporting the fact that fatty acids, monosaturated fatty acids, will actually help improving risk of development of cardiovascular disease. And I also want to show a third one showing that in fact we can trust the research that says that nuts have high effects of high monosaturated fat diet can help also with the development with cardiovascular disease. Thank you.